Hello guys, welcome to BioTube Academy. When we hear the word cancer, we usually think about organs like the lungs, breast, liver, or skin. But have you ever wondered, can the heart also develop cancer? The answer is yes, but it is extremely rare. In fact, heart cancer is one of the rarest types of cancer in the human body. So, why is heart cancer so uncommon? What causes it? What are its symptoms? And how is it diagnosed and treated? Let's find out. Segment 1, What is cancer? Before we understand heart cancer, let's first understand what cancer actually is. Our body is made up of trillions of cells. Normally, these cells grow, divide, and die in a controlled manner. However, sometimes a cell undergoes genetic changes that cause it to grow uncontrollably. Instead of dying when it should, it continues multiplying and forms a mass of abnormal cells called a tumor. Some tumors are benign, meaning they are not cancerous and usually do not spread. Others are malignant, meaning they are cancerous and can invade nearby tissues or spread to other parts of the body. This uncontrolled growth of malignant cells is what we call cancer. Segment 2, Can the heart get cancer? Yes, the heart can develop cancer, but it is extremely rare. There are two main types of heart cancer. The first is primary heart cancer, which begins inside the heart itself. This type is very uncommon. The second is secondary heart cancer, also called metastatic heart cancer. This occurs when cancer starts in another organ, such as the lungs, breast, or kidneys, and later spreads to the heart. Interestingly, secondary heart cancer is much more common than primary heart cancer. One reason heart cancer is so rare is that heart muscle cells divide very little compared to cells in many other organs. Since cancer often develops in rapidly dividing cells, the heart is naturally less likely to develop cancer. Segment 3, Symptoms of heart cancer. The symptoms of heart cancer can vary depending on the size and location of the tumor. Some patients may not experience any symptoms during the early stages. As the tumor grows, it can interfere with the normal function of the heart. Common symptoms include chest pain, shortness of breath, fatigue, irregular heartbeat, dizziness, fainting, and swelling of the legs or ankles. In some cases, pieces of the tumor may break off and travel through the bloodstream, potentially causing serious complications such as a stroke or blockage of blood vessels. Because these symptoms are similar to those of many other heart diseases, heart cancer can be difficult to recognize without medical testing. Segment 4, Diagnosis and Treatment. Doctors use several tests to diagnose heart cancer. One of the most important tests is an echocardiogram, which uses ultrasound waves to create images of the heart. CT scans and MRI scans provide detailed pictures of the heart and help doctors determine the size and location of the tumor. In some cases, a biopsy may be performed to examine the tumor cells under a microscope and confirm whether they are cancerous. Treatment depends on the type, size, and stage of the cancer. If possible, surgery may be performed to remove the tumor. Some patients may also require chemotherapy, radiation therapy, or targeted treatments to control the disease. Because heart cancer is so rare, treatment often requires a team of specialists working together. Segment 5, Can heart cancer be prevented? Since primary heart cancer is extremely rare and its exact cause is not fully understood, there is no guaranteed way to prevent it. However, maintaining a healthy lifestyle can reduce the risk of many cancers and heart diseases. Eating a balanced diet, exercising regularly, avoiding tobacco, limiting alcohol consumption, and attending regular medical checkups all contribute to better overall health. Early diagnosis of cancers in other parts of the body may also reduce the risk of cancer spreading to the heart. Segment 6, Conclusion. Let's quickly summarize. Heart cancer is one of the rarest forms of cancer. It can either begin in the heart itself or spread from another part of the body. Although it is uncommon, it can seriously affect the heart's ability to function. Recognizing the symptoms and seeking medical attention early can improve diagnosis and treatment. Thank you for watching. If you found this video helpful, don't forget to like this video, subscribe to BioTube Academy, and turn on notifications for more fascinating biology and medical science content. See you in the next video.